I can tell you that the situation is not good at all.
Halfway through January, researchers say the fast-spreading Omicron variant will exceed the previous Delta peak back in September. Oregon Health and Science University is forecasting a peak of 1,652 people hospitalized by the end of this month, a new record.
And you may say, oh, how many weeks away? How bad could it get? It turns out from other countries and other states, we can see that the hospitalized population goes up very quickly.
OHSU's Dr. Peter Graven publishes the projections. He says Region 5, which is Jackson and Josephine counties, will see the biggest impact next month after the majority of the state gets hit.
My guess, though, is the census will start shooting up now. But because of being a little bit more small, few more smaller towns, few more rural areas, it may get there a little bit slower. But we're talking about, another week or two at most.
Dr. Graven says the infections will impact pretty much everyone, vaccinated or unvaccinated, because Omicron is so contagious. For hospitals, that means having enough beds available, enough supplies on hand, and enough staffing.
The biggest concern is making sure that we have enough beds for all the patients, and that's one of the things that we take into account with our surge planning. We're anticipating a large number of people, and in that case, we're looking at beds. Where can we put them? How do we make sure we have them staffed?
Asante spokeswoman Lauren Van Sickle says from the Delta variant, Asante learned how to get creative with where to put patients safely while still providing quality care. She says Asante is now prepared to use unconventional spaces if it comes to that.
Just at any space within the hospital facilities. So it could be a hallway, it could be a lobby, it could be a cafeteria. We just don't know at this point, but those kind of are the last resorts. But we want to make sure that should we need the last resort, that we're prepared.
In the meantime, some support is coming to hospitals. Earlier this month, Governor Kate Brown ordered hundreds of National Guard members to help combat the surge of COVID-19 cases. 1,200 Oregon citizen soldiers and airmen mobilized last week to help in 40 hospitals across the state. Major Rob Rannett with the 186th Infantry in Ashland says he believes local Guard members will be deployed to Mercy Medical Center in Roseburg, Curry General Hospital in Gold Beach, Asante hospitals in the Rogue Valley, and Providence Medford.
Our state mission is to remain ready to assist with preventing or safeguarding property lives and reducing human suffering.
Van Sickle says Asante will see around 130 National Guard members across its Medford, Grants Pass, and Ashland locations. She anticipates the National Guard will be here at least till the end of February.